Hello everyone, welcome to AURICULATES weekly news. Hope you're all doing good. This week I'm back again with more interesting medical updates. But before getting into the news, let's look into today's clinical case. A 37-year-old male presented to the emergency room with complaint of pain in the right iliac fossa since 2 days, increase in severity since few hours. The pain is sharp, stabbing in nature, it's not radiating and it is 10 by 10 on Wong-Baker scale. It is aggravated by movement and not relieved by anything. The associated symptoms are nausea, vomiting. On abdominal examination, there is tenderness in the right iliac fossa, rebound tenderness is positive and there is deep tenderness at McBurney's point. Complete blood picture shows elevated WBC count. So what are the DDs and what do you think is the probable diagnosis? So getting into today's news, 5,133 DM, MCH and DNB super specialty seats up for grabs in MCC NEET Super Specialty Counseling 2022. The maximum number of DM seats are available in the specialty of DM Cardiology with 435 seats, followed by DM Neurology with 251 seats, followed by DM Nephrology with 194 seats. And MCH Urology has the highest number of seats with 314 seats offered to the candidates this year. And the highest number of DNB seats are available in the super specialty of DNB Critical Care Medicine. AIIMS New Delhi empowers persons with disabilities by providing support in terms of rehabilitation and helping them attain their true potential. A motivational speech was given by Dean Professor Dr. Subrata Sinha and Professor Sanjay Wadhwa on International Day of People with Disabilities. A new report by WHO shows the evidence of higher risk of death and illnesses among those persons with disabilities compared to others in the society, even up to 20 years earlier than those persons without disabilities. This is due to health inequities, and the report stresses on the need for urgent action to address these vast inequities in the health caused by unfair factors within the health system and shines light on the inequities the disabled people face while trying to access the care they need. Health system should be alleviating the challenges the people with disability face, not adding to them, said the WHO Director General. As I said earlier, in the last week, there is a rapid increase in the measles cases with 717 cases reported in Maharashtra so far this year, Mumbai being the worst affected. And healthcare workers wade through waist-deep water in river Bakra in Araria district of Bihar to provide vaccination to children to prevent measles. China medical experts say COVID has mutated, should be renamed. On Monday, the official Xinhua news agency said in a commentary that the most difficult period had passed, citing the weakening pathogenicity of the virus and efforts to vaccinate 90% of the population. In an unfortunate incident, a third-year MD resident doctor of BJ Medical College in Ahmedabad committed suicide in his hostel room after injecting a poisonous substance. This is the fourth case of doctor suicide reported from BJ Medical College, Ahmedabad in the year 2022. The Supreme Court on Monday directed the Ministry of Health and Family Welfare of the Union Government to examine the means to improve the conditions of the person suffering from chronic fatigue syndrome or myalgic encephalomyelitis, which is recognized as a neurological disease by WHO. The issue arose in a petition filed by a person claiming to be suffering from this condition. The grievance of the petitioner is that although a national policy for treatment of rare diseases was framed back in 2017 and was later revised in March 2021, no steps were taken to diagnose and treat the rare diseases from which the petitioner was suffering. Patient dies during appendicitis surgery. The Consumer Court holds the surgeon, 2 anesthesiologists and a Visakhapatnam-based private hospital guilty of negligence and directs 40 lakh rupees compensation to the family of the patient. Revolutionizing the healthcare with the drone power. Northeast's first drone delivery hub in Meghalaya will strengthen the healthcare services in the region by supplying medicines in remote areas. Drone delivers drugs to remote Meghalaya Health Center in record time. Taking medicines to the primary health center at Pedal Doba in the West Garo Hills district of Meghalaya is an uphill task, so is it to the 5 remote subcenters under the center. The scene is expected to change on Monday when the center receives a consignment of medicines, vaccines and other healthcare necessities delivered by a customized drone. The drone station has been built at the subdivision hospital in Jenghal. The aid delivery of 1.5 kg of medicines to a remote location marked the unveiling of India's first drone station for transporting drugs at the Jenghal subdivision hospital in Meghalaya. Pedaldoba is one of the remotest areas in the West Garo Hill district. We look forward to the drone delivery system for serving 18,599 people across 55 villages better, a paramedic at the Pedaldoba PHC said. Melinda Gates, co-founder of Bill and Melinda Gates Foundation, said India has been a champion in pioneering innovations to fight the pandemic and minimize its impact on the most vulnerable groups. India's COVID-19 vaccination drive is amazing, covering over 90% of the population in such a short time, she said. A 67-year-old man with Zika virus has been found in Pune city, Maharashtra. The patient is fully recovered now and has no symptoms. Zika virus is a mosquito-borne flavivirus which was identified in Uganda in monkeys. Majority of the people affected with Zika virus do not develop any symptoms. The symptoms are usually mild, including fever, conjunctivitis, rash, body pains and headache, which usually lasts for about a week. Aging in eye can predict the kidney failure risk, finds a study. In this study recently published in the American Journal of Kidney Diseases, retinal age gap, which is a clinically validated and aging biomarker based on the retinal imaging, was associated with future risk of kidney failure among UK residents. This non-invasive and aging biomarker may hold promise to assist in the identification of people with high risk of kidney failure. So coming back to today's clinical case, the DDs are, yes, it could be acute appendicitis or testicular torsion, that is torsion of the undescended testis, or it could be a right-sided ureteric colic. Sometimes it could be a perforated duodenal ulcer where there is pain in the right side of the abdomen, or it could be Meckel's diverticulitis if it is a young patient or a child. And in females, the DDs would be ruptured ectopic pregnancy, torsion of the ovarian cyst, or even pelvic inflammatory disease. But in this case, looking into the history, the physical examination and the McBurney sign being positive and the Alvarado score, which is more than 6, because there is tenderness in the right iliac fossa, there is rebound tenderness, there is elevated WBC count, and also there is nausea and vomiting. So the Alvarado score is more than 6, so it could probably be acute appendicitis. And the most important ones here are the Murphy's triad of symptoms, where there is pain first, which is followed by vomiting, and vomiting is followed by fever. This is called as Murphy's triad. And the important signs in acute appendicitis are one is cough tenderness, that is Dunphy's sign. This is due to involvement of the parietal peritoneum. This is an important physical sign which differentiates between the acute appendicitis and right-sided ureteric colic. And another one is psoas sign, where any attempt to extend the hip produces pain because of irritation of the psoas major muscle, which is especially seen in retrocecal appendicitis. And then there is obturator sign, where any attempt to flexion and medial rotation of the hip produces pain due to irritation of the obturator muscle. And then there is this Rovsing sign, where any palpation in the left iliac region produces pain in the right iliac fossa, that is Rovsing sign. And then there is Blumberg sign, which is due to involvement of the parietal peritoneum. There is rebound tenderness at the McBurney's point. And also there is hyperesthesia in the Sharon's triangle, which is formed by anterior superior iliac spine, umbilicus and the pubic symphysis. And coming to the complications of appendicitis, there could be rupture of the appendix leading to generalized peritonitis, there could be appendicular mass formation, or there could be perforated appendicitis, or there could be appendicular abscess formation. And coming to the investigations, there is an elevated WBC count, a plain X-ray erect abdomen can be taken to rule out the perforation, and ultrasound abdomen can be taken to rule out other causes including the gynecological causes. However, CECT abdomen is the investigation of choice. And coming to the treatment, first you have to stabilize the patient by giving IV fluids, and the patient is usually posted for emergency surgery, that is open appendectomy, followed by antibiotics in the post-operative period. So that's all for today guys. We'll be back again next week. Hope this video is helpful to you. Please like, share and subscribe to Auricle for more interesting updates. You can also follow us on Instagram and Telegram. Bye bye.